I am Dr. Santosh Trivedi, consultant neurologist from Institute of Neuroscience, Kolkata. Today we are going to talk about Parkinson disease. So, why we need to talk about Parkinson disease? Many of the patients come to us in our OPD of Parkinson disease, but the number of patients what we see in the OPD is much less than what is the number of Parkinson disease prevalent in the society. It's like an iceberg phenomenon. The number what we see is just tip of iceberg. Much more number of patient is prevalent in the society who is not aware about the symptoms of the Parkinson disease, because there are many different types of symptoms which is happening in the Parkinson patient, which the patient or their family member cannot recognize. So they don't try to avail the treatment for their problem. In Parkinson patient, what we see in our OPD, the classical symptoms which occurs is bradykinesia, slowing of the movement, tremulousness. So these are the classical problem of the symptoms of the Parkinson disease. But apart from these classical symptoms of the Parkinson disease, there are many much more symptoms which the patient or their family member cannot recognize. Just for example, what we see, the patient of Parkinson disease came with complaint of frozen shoulder. They have difficulty in painful movement of the shoulder joints. So there is no other symptoms. They have just pain in the shoulder joints. So they roam around with their symptoms to orthopedic surgeon, to many other general physician. But the underlying problem for the frozen shoulder is Parkinson disease. Similarly, there are symptoms like disturbance of sleep. They will say in the night time, the patient will have sudden dreaming which they enact. There will be movement, shouting, screaming, and their family member will complain of the patient is shouting, dreaming, fighting in the sleep. And these symptoms, what we call REM sleep disorder, which is not recognized by either patient or their family member. So they delayed to get the treatment for the same. Similarly, many patients complain of multiple somatic pains. They will have pain at various places, intermittent. They will have low mood. They will have slow cognition. They will have difficulty in their brain function. So these are all non-motor symptoms of the Parkinson disease. They will have bowel disturbance, constipation. So everything, these are the symptoms which is not recognized by either patient or their family member. So they don't come to neurologist, and because of that there will be delay in the starting of the treatment, and because of that the quality of life of the patient will be hampered. By coming to the neurologist, they will get the proper treatment, and with those treatment the quality of life of the patient and their family member both improved. Similarly, the problem with patient will come difficulty in walking, unsteadiness of gait. So these are the typical symptoms of Parkinson disease. But non-classical symptoms is much more prevalent than classical symptoms. And if patient or family member come to know about these symptoms, they will try to avail the treatment of neurologist as early as possible. Another thing of Parkinson disease is that there are some good Parkinson disease and some are bad Parkinson disease. The good Parkinson patients remain very good on the adequate dose of anti-Parkinsonian drug for long time and have a good quality of life both for the patient and their family member. But when there is bad Parkinson, so in bad Parkinson patient, they will come with in the early course of the disease, there will be history of fall, there will be history of hallucination, delusion, there will be early history of decreased cognitive function, forgetfulness, there will be early history of fall. And so these early other symptoms, these are called red flag sign, which indicates the patient is suffering from some bad Parkinson. These kind of Parkinson patients, they deteriorate rapidly, and for these patients, Parkinsonian drugs help them to some extent, but not like a typical Parkinson disease. We can adjust the dose of the anti-Parkinsonian drug. There are many drugs with adequate dose, proper titration. These patients do well, and their family member and quality of the patient both improve remarkably. Thank you for hearing the video.